Back in the 1990s, Portugal faced a heroin crisis. 1 in 100 people were using the drug. It took something drastic to turn things around. Here's how Portugal kicked the habit. While the Western world experienced the social and cultural revolution of the 60s, Portugal was kept isolated by the dictator António Salazar. In 1974, the Carnation Revolution overthrew his oppressive Estado Novo regime, and the Portuguese people were suddenly exposed to newfound freedoms.
Censorship was at an end, freedom of speech restored, elections promised, and most important of all, the end of Portugal's colonial wars in Africa.
This was the catalyst that would lead to Portugal's problem. Attitudes towards drugs and experimentation were relaxed. At the same time, the population grew, with up to 1 million people arriving from the colonies, just as the country fell into a severe economic depression. As if on cue, cheap heroin from Afghanistan and Pakistan flooded Europe. While most countries had experienced fighting drugs, the new, liberal Portugal wasn't prepared. By the 90s, an estimated 1% of the population was using heroin.
It was almost impossible to find a single family in Portugal that had no problems connected to drugs.
Dr. João Goulão formed part of a team of healthcare professionals to rethink how Portugal dealt with drugs. Feeling like they had nothing to lose, their solution was radical. On July 1st, 2001, Portugal became the first country in the world to decriminalize all drugs. What that means is while they remain illegal, possessing small amounts of anything from cannabis to cocaine or even heroin doesn't result in arrest. Users aren't considered as criminals, but rather treated as patients in a health-first approach. Instead of facing a judge, they meet a dissuasion panel made up of lawyers, social workers and medics. Before decriminalisation, around 90% of funds spent on fighting drugs went on enforcement and just 10% on healthcare. After 2001, that was reversed. Critics claim the change in law might encourage users and even attract drug tourists, and there is some evidence that suggests small increases in reported drug use. But advocates of decriminalisation say that drug users are more likely to find help if they know they won't be locked up. The number of Portuguese in rehab programs rose from just over 6,000 in 1999 to nearly 26,000 in 2008. While those using heroin has fallen from about 100,000 to around 50,000 today. And drug-related deaths have fallen dramatically. In 2015, Portugal had just 6 deaths per million people, the lowest in Western Europe and a tiny fraction of that in the US. The numbers show just how remarkable Portugal's turnaround has been. Due to its geography, it serves as a gateway for trafficking into Europe, so stamping out drugs just isn't realistic. Instead, it's shown that a humane and health-led approach can be much less damaging to society.